Hello, Family Cafe. I'm Liz Miller. I'm the CEO of Sunshine Health and a registered nurse. Sunshine Health provides Medicaid, Medicare, and health insurance marketplace coverage across Florida. We are proud of our partnership with the Family Cafe to improve the health of all Floridians, not just those that are in our health plan. We believe in giving back to the communities where we live, work, and serve. One of our most important initiatives right now is a public service campaign encouraging people to get COVID-19 vaccines, especially in communities of color where there may be higher levels of vaccine hesitancy. We teamed up with the Pro Football Hall of Fame and former Tampa Bay Buccaneer, Derek Brooks, for this campaign. Together, we're asking people to get educated about the vaccine and make the decision that's right for you and your family. But don't just take it from me. Let's hear from Derek himself.
Again, gorgeous weather, and here at One Buck Place, some would say a second home to a certain degree, but I'm just here today, honestly, to really thank Sunshine Health for partnering with the Hall of Fame, as well as our Tampa Bay Buccaneers, and showing how it's powerful if we can come together as a team, what we can do. And as I say, we have a team attitude of together everybody achieves more. It's coming together as I share my message that everybody get all the education you need about the vaccine process and the vaccine itself to get you comfortable to make a decision to get vaccinated. As we move forward, the more education that we can provide to one another and share those experiences, I just believe we're moving in a positive direction to really start to defeat this pandemic one step at a time. So I just want to encourage everybody to seek the information as you make an informed decision, and know that you're making this decision as part of a team of people, as Liz said, that's involving millions of us making this decision together. As this vaccinated was tested across all groups of societies, very diverse testing. In my own research, when I decided to do it, really allowed me to be comfortable in making that decision. That it's for all of us, it's for every one of us. At the same time, I do understand when people are hesitant. And I say, take your time and make the best informed decision that you can do. There's no such thing as a bad question as long as you're seeking the information to help you make that decision. So I just stand here as one of many to say that I'm proud of the partnership here with the Pro Football Hall of Fame, the Bucks, and Sunshine Health, in bringing this information to our general public. So thank you for your time. Hello, my name is Derek Brooks, and I'm a member of the Pro Football Hall of Fame. I have many close family members and loved ones that count on me for their well-being and their safety. Letting them down is not an option. That's why I'm getting the COVID vaccine. Please get the vaccine. Start by making your plans today to get all the answers you need.
Please visit the Centers for Disease Control website at cdc.gov for information on the COVID-19 vaccination and other safety information.
Thanks to one of our sponsors, WellCare, and former Tampa Bay Bucks linebacker Derek Brooks for that little video. Matt Martucci back with you folks. The 23rd Annual Family Cafe. We are still getting rolling. We are a few hours into this thing today. Day number 1 of what is 3, and what is an amazing conference and an amazing get-together every year. We've been doing this since 1998. And happy to have you following along if you're here in person or virtually. And if you're here in person and you happen to be watching this back later, I guess that would be the only way you could, in fact, be following along. But want to take this time real quick to recognize some of our sponsors. Able United, Career Source Florida, Children's Medical Services Health Plan, Disability Rights Florida, the Florida Department of Education, and the Florida Department of Education, the Division of Vocational Rehabilitation. We'll actually hear from Director of Vocational Rehabilitation, Allison Flanagan, a little bit later in the program as part of some of our presentations here in the International Plaza Ballroom. Shortly, we are going to hear from Steve Carter, who is the interim CEO of MyHana, which is a community for those with autism and autism caregivers as well. So we're going to bring Steve in, I think, in 1 second.
Okay, I'm Nick.
And we have Nick as well, Nick Garafolo. We're going to get Steve in here. Okay. Yep, absolutely. Yep. It doesn't matter whoever would like to wear it.
Thank you very much. This is all new to me here.
Yep. Yeah, we're gonna move you in here. We'll get you in position.
Okay, where do you want me to look?
You're gonna look right at the camera here, Nick.
This camera right here?
Yes, sir.
Okay. All right.
Well, we bring in Nick Garafolo, who I believe the founder of MyHana, right?
Yes, absolutely. Thank you for having me today.
I know.
Appreciate
Great to be here with you.
Okay, sure. First time here?
Yeah. Tell me about kind of the history of MyHana. How far back does this go?
Oh. You caught me a little off guard. It goes back to
Here,
God when I'm 5 years old. I'm legally blind, totally blind in my left eye, and I managed a chronic condition, my entire life. Last year, I couldn't see the food on my plate due to glaucoma and many of the conditions. Well, if I had a cornea transplant last September, which has given me a little of my vision back. But this all segues from, when I left my career in financial services, I figured, what am I going to do with all my time? I'm still young, and I looked at, how I can serve, and I looked at the autism community in specific. I was affected by some family members and so forth and so on, and I looked at it as a space that had some very serious challenges, and my wife and I decided to take some of our finances and try and impact the community.
And where are you based out of, Nick?
Steve, my interim CEO,
he's up near me. He's in Medford, New Jersey.
Right,
yeah, I believe. Right.
I'm down in Fort Myers, and I call home Park City, Utah.
Okay.
So I pretty much live most of the time out there. I was in New Jersey for probably the last 45 years.
Okay. And how in fact, did you get hooked up with this wonderful event in the Family Cafe?
Well, Vince Sequenzio, who ran ASA Florida for some time, came on board along with Scott Badish, who was the chairman of the Autism Society for many years. They saw the passion I had for the space, but most importantly, they saw what we were doing and how we could impact the space with our product, MyHana.
And when we talk about MyHana, what if you had to kind of pitch the community to someone who's never necessarily heard about it or isn't all that familiar with it, what would you say?
It's pretty simple. It's parents are challenged on a daily basis, and they're challenged emotionally, financially, educationally. There's communal challenges. And we provide an online product and solution to engage and educate and inspire those parents. Now, these parents, when you look around the community as a whole, there's hundreds of millions of dollars pumped into the system through philanthropy.
Yes, sir.
We see all throughout the country that there's still tens, if not hundreds of thousands of parents that are on waiting lists. I met a woman today, 16 years. So there's hundreds of thousands of parents on waiting lists, and it's not acceptable.
No, it's not.
It's clearly not, and we're going to do something about that. That's what our plan is.
I love to hear that.
Right.
What about events? Anything coming down the pipe for MyHana?
Well, what we're trying to do right now is we consider this our official launch here in Florida. We're engaging with some groups down here to find some aggregation points to get the product out into the market. So we have a little program called Wisdom Caregivers. We're going to be hiring parents and training them on how to mentor parents and how best to use the product. 37%, if not more, of parents have had to forego a job. So we want to offer job opportunities for parents to work as aggregation points and sales points for the product. And that's one of the key aspects of what we're doing. down here. But more importantly, we're going to work with, some other support groups and hopefully some of the state agencies and address the dire needs that are out here and the challenges that, thousands of parents are facing, just not here in Florida, pretty much all over the place. But we want to focus on here. A lot of my team is down here too. I call Florida home now also. So,
good.
Let's try and get this done here. We have a remarkable product that I believe, our value propositions really will address the 4 pain points. Real quick, the value propositions that we have is workshops and webinars provided by nationally known faculty. We have a navigation tool, proprietary My Navigator, which collects clinical and behavioral data.
Okay.
And we make
That's
it
amazing.
very simple that parents can build multiple teams. They can build a clinical and behavioral team, an educational team, a financial and legal team, and through our navigation tool, collect information and data and seamlessly share that. We have a HIPAA-compliant document storage solution, which segues into the navigation tool, where parents can go and keep all of their documents and store them.
Everything's right there.
From early intervention through age out, when your child goes off to college or goes off on his own, or, we found the number one concern of parents is that they're concerned about an independent future for their child after they leave, and this is a lifelong tool. We also have, a very simple to use calendar, because there's medical incidents and there's you have a lot of meetings with teachers and keeping track of all of this.
It's like it's almost like a virtual file cabinet, if you will.
Pretty much is what it is. And again, keeping the calendar of everything. You can leave, video clips, audio clips. Something happens on the fly. You take those clips, you upload it into your storage solution, share that with doctors,
and then
team members.
Everybody's on the same page. Everybody has it.
This is consistent collective collaboration, but in a very simple manner. And last but not least is parents go today and they go all over the internet, which has become a problem. Internet content is vague. It's very, very broad, and it leaves parents more confused with bigger knowledge gaps, and they're not able to make good decisions.
Than when you started there. It's almost like looking at WebMD for your diagnosis, right?
Well, we handle it a different way. We brought in some great faculty from Rutgers and some of our other team, and we've done this through curriculum. And we tie the curriculum back to the navigation tool. There's goals you can create and so forth and so on. And you could really feel a sense of accomplishment when you're completing these courses. So this is pretty much taking the place of, hey, here's something, go read it. People walk away, they get half bored with an article. So we have a very engaging curriculum. And lastly, parents deserve, there's only a choice few in the country that have, the financial standing to handle the financial costs associated with autism.
Absolutely.
And we believe, and we've seen that a lot of parents don't have access to the services that they need because they can't afford them. We're building a team of attorneys that will do a will and a trust and a guardianship for 50% less than you would walking off the street. Scott Badish, who ran the ASA, will do Social Security forms for $250.
Oh, that's amazing.
You'll pay an attorney $1,500. We have companies that will do trusts for people, which is very important. But what I'll remind people is, and I'll leave with this, is that recently my sister-in-law from a prior marriage just passed away at 59. And she left
sorry to hear that.
She left Mark at 20, with no guardianship. She had no will. She left us a box of papers. And now Mark is spiraling somewhere in the system in New York City. And that's just not acceptable. And we just don't want to see that happen. And that's inspired us even more to work on this and get this out into people's hands here.
Well, so. I know I speak for everyone, Nick, when I say we are sorry for your loss. Right. And I really appreciate that you took the time to stop by and inform and educate.
Right. No, I'm thrilled here. And www.myhana.org. There's phone numbers on there, emails. Reach out anytime you want, any questions, and so forth and so on.
Excellent. Thank you so much.
Okay. Thank you very much.
You enjoy the rest of the weekend.
Great. Thanks. Thank you very much for having me.
Absolutely.
Appreciate it.
Our pleasure.
Thank you. Thanks.
That's Nick Garafolo of MyHana. And, of course, you just heard him give out the information. Plenty of great resources there. for those in the autism community, caregivers, to make sure that your loved ones have, in fact, the care that they need and the comprehensive care, in fact, that they do need. You heard Nick say that they essentially attack the disability from pretty much every angle in terms of making sure that you and your loved ones have exactly the resources and level of resources that you, in fact, do need. So great information there. Reminder of what is still to come here as far as later. You just ended up hearing about life care planning, and you heard Nick talk about along the lines of wills and trusts. We had Doug Vogel in from Mass Mutual, who gave what was a great hour-long presentation, basically laying out wills and trusts and making sure you have a care letter for your loved ones. Just a lot of different things to talk about and in fact discuss. So thank you so much to Nick Garafolo for in fact stopping by. So we're going to bring our next guest in. We'll move over a little bit on the table. And let's get it nice and close.
Okay. Thank you, sir.
All right. We have Christine Rudd, who is, in fact, the author of a book, Cooking with Ease, Your Guide to Cooking with a Disability. Christine, welcome to the program. How are you?
Thank you so much. I'm wonderful. Thanks.
Great, great. Well, tell us a little bit about your book and what brought you to the Family Cafe.
So I've been coming to the Family Cafe for, I think, 5 years now.
Okay.
But writing the book was basically because I felt like people with disabilities needed to be able to have things that they could cook that are healthy. I feel like a lot of people have misconceptions that people with disabilities can't cook healthy meals, and there are so few people with disabilities that are authors, so I felt like it was important to write the book.
Oh, absolutely. Well, what about you? How long have you been cooking?
Probably since I was 19.
Really? And
Yeah.
how old are, and I know this is not typically a question that you ask a woman, but how old are you now?
I'll be 44 Sunday.
Wow, so 20 you've been in the kitchen 25 years.
Not all the time, but yeah.
Not all the time. Well, either way, that's a lot of cooking over the course of 25 years. What are your favorite dishes? What do you love to cook?
Probably pasta dishes, but I think I wanted to just say about the book, I think the important part of the book was that I brought out assistive technology pieces that people could use, because I think a lot of people are afraid to cook, but there are so many pieces of technology that are available now that maybe weren't available when I was younger, so I thought it was really important. No,
I think that's great. Let's actually get into some of those. What, as far as assistive technology, what do you end up highlighting here?
I talk a lot about rocker knives and cutting boards that are specifically for one-handed use, and also there are a lot of safety pieces of equipment that you can use when you're cutting things.
Okay.
And I try to do a lot of things for people with limited use of one hand.
Okay, I know that, and that sounds amazing. Yeah, that it obviously sounds like it's been very, very well thought out. How long? Now, you've been cooking for 25 years. Yeah. When did the book come out?
It just came out in January. It's available on Amazon. And
okay.
So I have also some here at the Family Cafe for sale.
Oh, excellent, excellent. When did you get the idea, though, to write the book?
The idea to write the book just came to me really out of nowhere, because I had an idea to write more disability kind of books with characters with disabilities, and so that'll be the next thing I'll be doing.
Oh, that's awesome.
But the cookbook just came out of nowhere, probably because I like to cook.
What about the hardest thing? You said you like to cook pasta typically. What's the most challenging thing for you to cook?
Probably, which I actually talk about in the book too, probably the hardest thing to cook would be meats that aren't pre-cut, but I think a lot of people don't realize that some grocery stores will cut food for you.
If you just go and ask.
Yes,
yeah.
In case. And that's the same like if you go to a restaurant, you can get your food cut for you. Like I can't use a standard knife. I don't like to say regular, but I can't use a standard knife. And so I think those are the kind of things that are most difficult for me to cook, and anything that would require me to use full use of both of my hands, because that's difficult.
What about your experience with the Family Cafe? I know you said you've been coming for quite a long time, but what does this event and this weekend just as a whole mean to you and your loved ones?
I think it's an amazing event to come and get information for people, to let them know there are resources out there. I think it's been very helpful for me to develop my skills as a speaker, because I've spoken on a couple different topics here. And I just think that anybody that has an opportunity to come should come. I know that with the virus it's a little bit difficult now and different, but I think the Family Cafe is always there with great information. They've got a great team, and I'm just so grateful that they're here every year, and it's a place to come and meet people and just have shared experiences.
Well, as far as those experiences and the friendships, what kinds of folks have you met? Have you made? I'm assuming you've probably made some lifelong friendships here.
Probably I've made some lifelong friendships that it's a sense of belonging, I think, certainly.
What about not getting to do it a year ago? You know, I mean, and not being here, and now getting back and being able to actually be here in person.
It's so wonderful to be back. It was so sad not to be able to come. I mean, it was understandable why we couldn't come. I just think it's a great time to just reconnect with people, be grateful for all the work that the team does to have everything here for us. Every year it just gets better. I've been here all those years, and just every year gets better.
Well, we're so happy that you're here, and this is what we're going to do for all the folks so they could see it at home. This is Cooking with Ease, your guide to cooking with a disability, and our author is Christine Rudd, so we'll hold it up a little bit more so everybody can see it. And we've got a nice back cover as well. There's a picture of Christine there. So if we were on QVC or the Home Shopping Network, this would be exactly what we'd be doing. We would be pitching your product right now.
Thank you. And it's available on Amazon.
And available on Amazon. So Amazon.com, and just search Cooking with Ease by Christine Rudd. Thank you so much for stopping by.
Thank you so much for having me. It was great to see
my pleasure, and you enjoy the rest of the weekend.
Thank you. You as well.
Christine Rudd. And buy her book, folks. Again, thank you to all of our wonderful guests late this morning, early this afternoon, as we are on what is day 1 of 3 here at the Family Cafe, the Hyatt Regency International Plaza Ballroom. And a special thanks to our production director, Michael Fahey, and all the incredible staff here. We actually didn't even recognize the Family Cafe staff. Laurie Fahey, of course, our president and CEO, Jeremy Countryman, who has been on the program director, and then Jesse Hansen, Northwest RDC coordinator, Joe McCann, who is right next to us, the policy manager, Sarah Fahey, financial administrator, and Nikki Germain, who is, in fact, the youth advisor. But so much goes into this, folks, in terms of the planning, as you might have heard this morning. About a month from now, after this conference, in fact, ends on Sunday, they will start making the donuts again in terms of the planning and trying to get themselves ready for this. So it looks like we have come into our 4 o'clock hour. So we will, I believe, step aside shortly here. But there is still plenty more, in fact, to come. There's a presentation coming from Allison Flanagan, the Director of Vocational Rehabilitation. So that is actually coming shortly, and I believe she's going to the podium right now. So we will talk to you in a little bit. Matt Martucci, we'll see you later.